So it has been a long time ki I haven't taken the lecture, but now the lecture will come at regular interval. I was involved in something. So today we'll take a very small lecture just to initiate. And today it's a very important case that may come in NEET PG or you might see it. So there was a girl. Uh, so see, there is a girl, a 17-year-old female who came to OPD, and the chief complaint. There were a lot of complaints, but the chief complaint was amenorrhea. Amenorrhea, that is absent menses. On examination, what we find, there was there was secondary sexual character present. Secondary sexual characters were present. Secondary sexual characters were present. For example, there was presence of the there was presence of axillary hair, there was presence of pubic hair, but they were sparse. They were not very dense. Secondly, breast development was not good. Breast was not developed. Although breast was present, it was developed, but it was underdeveloped. Developed. On examination, there was vagina was present, but it was ending in a blind pouch. So phenotypically, she was female. Although secondary sexual characters were not well developed, vagina was not well developed, and she was having amenorrhea. Now, uh, on examination, when ultrasound was done, there was present of ovary was present, but that was streak ovary. Streak ovary means fibrous ovary. Streak ovary means fibrous ovary. So there was presence of streak ovary. So streak ovary means that ovary is not formed. That is, there is dysgenesis. Uh, and when there is ovary, that is called as streak ovary or called as ovary dysgenesis, when the ovary is not completely formed. So this was present. On when hormonal profile was done, on hormonal profile, there was very large increase in FSH and LH, and estrogen was very low, very low. So finally, there was genetic counseling. Genetic counseling was done, and it came out to be XY. Now, भाई मतलब लड़की अंदर XY है, मेल है. From inside, she's male, having XY, but outside, she is showing all the features of male. अजीब सा केस है. अगर आपको याद हो, बहुत पहले गोविंदा की मूवी आई थी कि अंटी नंबर 1, जिसमें गोविंदा यूज टू वेयर जस्ट लाइक दी female getup. So actually, he was from inside male. So that is the situation here. Just like that Govinda movie anti number 1. The lady from inside genetical analysis is showing XY, but outside she is showing the phenotype of the female. So whenever you see this thing, the only thing that should come in your mind is SWYER syndrome. Once it used to be famous question in the एम्स एग्जामिनेशन में बहुत पूछते थे ये स्वायर सिंड्रोम के बारे में, लेकिन अभी इन्होंने कम कर दिया, बट देयर आर चांसेस दैट इट कैन बी रिपीटेड, दैट स्वायर सिंड्रोम्स कैन बी आस्क्ड अगेन. So actually, what is Sweyer syndrome? Before understanding Sweyer, so this is the clinical scenario that जो आपको जल्दी ज़्यादातर दिखेगा. But before understanding the Sweyer syndrome, you have to understand what is the normal development of the male and female. Because if you will not understand what is the normal development of the male and the female, you will never understand this Sweyer syndrome. That I swear. Okay. So let's see. So now, if we talk of the male, in case male, please understand there are two ducts. One is Wolffian duct. One is the Wolffian duct, and Wolffian duct is also called as the mesonephric duct. Mesonephric duct. See, this is my first class, so I am just starting. I am discussing a case. In detail, I will discuss gynecology in detail. around 50 to 60 lecture, and I will discuss these things, Wolffian duct, mesonephric duct, in great detail. But right now, whatever I'm teaching you, just to understand this syndrome. So Wolffian duct, and this Wolffian duct, like a wolf present in males, and what does it forms? It forms epididymis, it forms vas deferens, it forms seminal vesicle, and what else? It also forms ejaculatory duct. These are the four structure which you can remember as EVSE, electronic voting machine, electron EVS, environmental studies. Okay, then there is also, now coming to, in female we have a paramesonephric duct. It is also called as Mullerian. M for Mullerian, M for mom. So you can remember present in the females. What does it form? It forms fallopian tube. Please remember, paramesonephric duct or the Mullerian duct does not form ovary. ओवरी से नहीं बनती है. ओवरी के फॉर्मेशन कैसे होता है, याद रखिए. इन फीमेल्स वी हैव एक्स एक्स क्रोमोसोम्स. एक्स क्रोमोसोम्स पर कुछ प्रोटीन्स होते हैं और दूसरे एक्स क्रोमोसोम्स पर भी कुछ प्रोटीन होते हैं. वो मिलके ओवरी बनाती है. अगर किसी पर्सन में एक्स वाई है तो उसमें कुछ प्रोटीन तो प्रेजेंट होंगे, तो या तो ओवरी एक्स वाई है तो प्रेजेंट ही नहीं होगी ओवरी, जैसे कि मेल के नॉर्मल केस में होता है. और अगर वो कोई प्रॉब्लमेटिक सिचुएशन है, पैथोलॉजी है, तो उस केस में जो ओवरी बनेगी वो पूरी नहीं बन पाएगी, क्योंकि ओवरी के कुछ प्रोटीन्स, कुछ जीन्स एक एक्स क्रोमोसोम पे होते हैं, कुछ दूसरे पे होते हैं. तो जब तक वो दोनों पे नहीं होंगे, यू विल नॉट सी एन ओवरी. और अगर उस केस में ओवरी बनेगी तो ओवरी विल बी स्ट्रीक ओवरी, नॉन फंक्शनल ओवरी, तो उसको हम बोलेंगे दैट इज ओवरी डिसजेनेसिस. ओके, सो अगर आप कभी भी याद रखिए, अगर एक्स वाई सिचुएशन है, इन एक्स वाई सिचुएशन आइदर देयर विल बी नो ओवरी or the ovary, it will be formed, it will be streak ovary, non-functional ovary, or it will be called as the ovary dysgenesis. Please remember, because for the formation of the ovary, proteins and the genes are present, are required, which are present on both the X chromosome. Single X chromosome cannot produce the required amount of protein which is required for the synthesis of the ovary. This always remember, this is a concept. Okay, so that concept will also be utilized in this Sweyer syndrome. Now coming to the paranephric, it will form fallopian duct, paramesonephric duct or Mullerian duct does not form the ovary. Ovary is formed by the proteins present on the genes, by the genes present on both the X chromosomes. So it forms the fallopian tube, it forms uterus, it forms cervix and upper two-third vagina. These are the things that it forms. Okay. Now what happens in case of the male? Male we have XY chromosome, and on Y we have a SRY gene. SRY gene. So देखो, मेल बचपन से ही सॉरी बोलना शुरू कर देते हैं. Man started before the birth, they started saying sorry. So SRY gene is present on the Y chromosome, and it secretes what? It secretes TDF, that is testis determining factor. TESTIES, testis determining factor, and this forms the testis. And when testis is formed, testis secrete two hormone. One is testosterone and other is Mullerian inhibiting factor. Now, what does testosterone do? And what is the use of Mullerian? Mullerian inhibiting factor inhibits the Mullerian. So, there is no formation of the fallopian tube, no formation of the uterus cervix, no formation of the upper two-third of the vagina. So if someone asks you next time why in cases of the males there is no formation of the fallopian tube, uterus, cervix or upper two-third of the vagina, so you will say that testis produces Mullerian inhibiting factor, which inhibits paramesonephric duct or Mullerian duct formation, that leads to it, therefore there is no fallopian tube formation, uterus, cervix, upper two-third or the vagina. This is very important. And what does testosterone do? Testosterone will stimulate the mesonephric duct. So there is formation of epididymis, vas deferens, seminal vesicle, and ejaculatory. So these are the things are formed. So why a particular thing is formed, why a particular thing is not formed in the male, you have to understand this. Now, what happened in cases of the Sweyer syndrome? In Sweyer syndrome, we have this genotype. So this patient should present as a male, should have a male sexual character, should have a male organ. तो फिर ऐसा क्यों होता है कि नहीं होता? क्योंकि this SRY gene is absent. This SRY gene is absent in case of the Sweyer syndrome. So what happened? There is no testis determining factor. So there is no formation of the testis. So this is very important. Testis is also absent in this person. So there is no testosterone. And since there is no testosterone, there will be no stimulation of the Wolffian duct or mesonephric duct. भाई टेस्टोस्टेरोन ही तो Wolffian duct और mesonephric duct को स्टिमुलेट करता है कि वो epididymis vas deferens seminal vesicle ejaculatory duct बनाए. लेकिन when there is no testosterone, what will happen? There will be no stimulation of the Wolffian duct or the mesonephric duct. So there will be no epididymis, no vas deferens, no seminal vesicle or ejaculatory duct. So see the scenario, see the irony that although patient is having XY genotype, but because there is no SRY gene, no testis determining factor, no testosterone, so there is no Wolffian duct stimulation, and there are no male organ like epididymis, vas deferens, seminal vesicle, ejaculatory duct. Okay, now since there is no testis, so there will be no Mullerian inhibiting factor, so there is nothing to inhibit the Mullerian duct. So there will be formation of what? Fallopian tube, uterus, cervix, and upper two-thirds of the vagina. These things will be formed. So in this patient, in our patient also, there was fallopian tube, uterus, cervix, and upper two-thirds of the vagina was formed. I also told you that it ended in a closed pouch. Now, so what happened? Now, next point that we have to understand is that this patient is genotypically XY, but phenotypically there is no male organ and there are present of female organ, but they are not well developed. Now, what will happen to ovary? I told you for the ovary formation, you require the protein which are present, which are formed by the genes which are present on the both the X chromosome. But this patient has XY. So although it has gene on the X, but other X is not present. So there will be formation of the ovary? No. So the ovary which will be formed is the streak ovary. Again, I am telling you, और दिस इज कॉल्ड एज द डिसजेनेसिस ओवरी. तो भाई ना तो टेस्टिस है और ओवरी है, तो डिसजेनेसिस है, दैट इज स्ट्रीक ओवरी है. और ऑर्गन में देखा जाए तो क्या एपिडिडाइमस वास डिफरेंस मेल ऑर्गन नहीं है और फीमेल ऑर्गन प्रेजेंट है. तो एक अजीब सी पिक्चर, दैट इज व्हाट आई वाज टेलिंग यू, दैट देयर वाज अ गोविंदा मूवी इन व्हिच गोविंदा यूज्ड टू ड्रेस अप लाइक द फीमेल actress, but inside that is genotypically he was XY, but phenotypically there was no phenotypically he used to show as a female. So that is the thing that is present in the Sweyer syndrome. The main reason is absence of SRY gene. So that is what I wanted to tell you. Okay. So what is? Please remember very important point in this. We don't have testis here, and ovary is what? Streak ovary. Streak ovary. And the streak ovary, this can develop gonadoblastoma. That can develop gonadoblastoma. So what you will do in these patients, whenever you diagnose Sweyer syndrome, the first thing is that to आपको ये gonad उनको निकालना, you have to do the gonadectomy. You have to do the gonadectomy in such patient, because if you will not remove the gonad, that can lead to the formation of the gonadoblastoma. So the first thing when you diagnose the Sweyer syndrome, you have to plan a surgery for these patients. You have to find the ovary, you have to do the gonadectomy, and then the patient will be kept on the hormonal therapy, because because there is no ovary. So FSH and LH will continuously stimulate ovary. But there will be no estrogen. So estrogen will be less, and there will be negative feedback mechanism. So FSH and LH will increase. So that is why the hormone profile in this patient, you will see a hard lie, an increased FSH and LH, but estrogen will be less. So this patient, what you will do? You will do gonadectomy, and finally you will keep the patient on the hormonal replacement therapy. So this is a very good question. Although now on the regular basis, first I will finish gynecology, then I will finish obstetric. And I'm sorry कि I was this time मैं बहुत सारी problems में फंस गया था. So now I will put the lectures regularly. Thank you.